Everybody, I'm Dr. Armen, Professor Armen Astvatsatryan from Yerevan, Armenia. And so you're in a Dr. Y channel, so we continue to talk about your questions of the big exams, last questions, state exams, and today's questions are all about lung emphysema. Actually, all three questions about the same chronic obstructive pulmonary disease. But anyway, my friends, so if you find a question like this, lung emphysema, you have to answer in this manner. So what is lung emphysema? Lung emphysema, commonly known as just emphysema, is a type of chronic obstructive pulmonary disease that affects the lungs. Emphysema is a condition in which the air sacs alveoli in the lungs are damaged, resulting in reduced gas exchange and shortness of breath. Actually, lung emphysema is a COPD, but pathologically or radiologically defined, and chronic obstructive bronchitis, clinically defined. COPD, chronic obstructive pulmonary disease, comprises both lung emphysema and chronic obstructive bronchitis. But actually, lung emphysema, today's topic, is pathologically or radiologically documented, defined. And chronic obstructive bronchitis, previous lecture, is clinically defined. So it's largely sufficient for an answer. But anyway, you can continue, for example, in this manner. So in healthy lungs, the air sacs are elastic, and they expand and contract with each breath, due to surfactant, etc. In emphysema, the walls of the air sacs are damaged, causing them to lose their elasticity. This makes it too difficult to breathe, as the lungs are less able to take in oxygen and expel carbon dioxide, CO. Emphysema is most commonly caused by smoking, no COPD, because it's a smoker problems, as the harmful chemicals in cigarette smoke can damage the lungs over time. Other causes include exposure to air pollution, genetic factors, and certain occupations that involve exposure to chemicals or dust. Symptoms of emphysema can include shortness of breath, wheezing, coughing, and chest tightness. So it's actually the same chronic bronchitis, or the COPD just. There is no cure actually for emphysema, but treatments such bronchodilators, steroids, and oxygen therapy can help manage symptoms and improve quality of life. Quitting smoking is the primordial, so paramount importance. It's an important step in preventing further lung damage. So it's more than enough, but actually I find continuing of this the same question. Pathogenesis, etiology, pathology, pathophysiology means classification, no types. Science, clinic. When you find a question like this, clinic. Mind, signs, and symptoms. Clinically signs, clinically symptoms. Complications, treatment, and prevention of lung emphysema. So take papers and make your notes. Don't forget to make the notes. Okay, so pathogenesis, pathophysiology. Lung emphysema is a condition that occurs due to damage to the small air sacs, alveoli in the lungs. I understand, I repeat, but anyway, the question is like this. So the alveoli become enlarged and lose their elasticity, which leads to difficulty in exchange air, to gas exchange. This damage is caused by exposure to irritants, such as tobacco, smoke, or pollution, which cause inflammation and destruction of lung tissue. Genetic factors may also play a role in the development of emphysema, but it's not a genetic disorder. It's a genetic determination. It's a preconditioning. You have predisposed to have this problem. But if you don't smoke, no problems. No problem. Classification. Lung emphysema can be classified as either centriolobular emphysema or panlobular emphysema. Centriolobular emphysema affects the respiratory bronchioles and alveolar ducts in the center of the lung lobes, while panlobar emphysema affects the entire acinus, which includes the respiratory bronchioles, alveolar ducts, and alveoli. So, clinic signs and symptoms. So the signs and symptoms of lung emphysema may develop gradually and can include shortness of breath, especially with physical activity, wheezing, chest tightness, chronic cough, fatigue, unintentional weight loss. Complication, lung emphysema can lead to severe complication, including respiratory failure. As the damage to the lungs progress, it may become more difficult to breathe, and oxygen levels in the blood may decrease. Pneumothorax. Pneumothorax, this is a condition where air leaks from the lung and enters the space between the lung and the chest wall, causing lung to collapse. So this is a pneumothorax, one of the complications. The condition where air leaks from the lung and enters the space between the lung and the chest wall, causing the lung to collapse. There's collapse of the lungs, pneumothorax. Pulmonary hypertension, not very often complication, pulmonary hypertension, and emphysema can cause high blood pressure in the arteries that supply blood to the lungs, leading to the heart failure. No, actually, it's a more right heart failure, but anyway, it's a heart failure. It's a very, very dangerous sign. Management, no treatment, management. Treatment, we have to understand, my friends, this is no cure for lung emphysema. So lung emphysema is a chronic obstructive pulmonary disease, but defined with your examinations. So radiologically, why not pathologically defined? So of course it's not curable situation. It's not curable condition. So all can we do so to prevent, try to prevent exacerbations and complications, very dangerous complications. So we can manage the symptoms palliative way and slow the progression of the lung failure, progression of the disease. So treatment options include medications, bronchodilators, steroids, and antibiotics may be prescribed to improve breathing and reduce the risk of infections. Oxygen therapy. Oxygen therapy may be needed to improve oxygen levels in the blood. So, of course, we start with quit smoking. Then medications, bronchodilators, steroids, and why not sometimes antibiotics may be prescribed to improve breathing and reduce the risk of infections or reinfections. Infections, reinfections, overinfections, superinfections. We told about oxygen therapy, once again, may be needed sometime to improve oxygen levels in the blood. No, it depends. Pulmonary rehabilitation, very important part, is a program of exercise, breathing techniques, and education can help improve breathing and quality of life. It's very, very important. But anyway, principally, paramount importance is quit smoking. Yes, and surgery, of course. In severe cases, surgery may be recommended to remove damaged lung tissue. No, this is utopia, maybe, theoretically. It's a very complicated operation, a very sophisticated operation. They need very serious stuff. And finally, prevention. Prevention, the best way to prevent lung emphysema is to avoid exposure to irritants. First of all, cigarette smoke, pollution, and chemicals. Quitting smoking is the most important step, the paramount importance, once again. Is the goal of your management. So quitting smoking is the most important step in preventing emphysema, and smoking is the leading cause of the condition. Like chronic obstructive pulmonary disease, once again, chronic bronchitis, all is the same history. All is the same link of the same chain. Regular exercise and maintaining a healthy weight may also help prevent emphysema. So that's all concerning lung emphysema, or emphysema just. Thanks for your attention, my dear friends. See you in another lectures. Don't forget to re-listening this video several times until you get it under your skin. And make the notes. Right? Yes, of course, don't forget to subscribe and follow the channel. See you in another lectures, my friends. God bless you. Bye-bye.